Good morning, everyone. So, I am Professor Kiran Sharma, HOD cum Professor in the School of Nursing Science and Research, Sharda University. So, today I am going to take a class on myocardial infarction. Now, I am going to share the slides with you. So, today the topic is myocardial infarction. So the contents which we are going to deal in this particular topic, that is, we will deal with the definition, we will deal with the types of infarcts, we will deal with the epidemiology, etiology, etiopathogenesis, pathophysiology, clinical manifestation, diagnosis, management, that includes your non-pharmacological management, pharmacological management, nursing management. So these all are the contents for this particular topics which we are going to deal. Now comes to the what is the definition or how we can define the myocardial infarction. So myocardial infarction is defined as a disease condition which is caused by reduced blood flow in a coronary artery due to atherosclerosis, or we can say that occlusion of an artery by an embolus or thrombus. So, what is myocardial infarction? It is like it is occurred due to the insufficient blood flow to the heart muscles from narrowing of the coronary artery, which may cause the chest pain also. So, myocardial infarction, or we can say the heart attack, is the irreversible damage of myocardial tissue caused by prolonged ischemia and hypoxia. So, this is all about the myocardial infarction. Next, we will see from this slide that we can see that this is the artery is shown there, in where we can see that blood clot is also there, that there's formation of plaque, that is cholesterol plaque formed, due to which there will and narrowing of the artery, due to which there will be an insufficient flow of blood to the heart. And these all the highlighted coronary arteries you can see through this slide. Next comes like types of infarctions. So there are some types of infarction which are characterized due to some specific things. Like first one is according to anatomic region of left ventricle involved. So due to this, there are some types of infarction like anterior infarction, posterior infarction. Means these all infarction depends on like to the site where the infarction occurs. So anterior infarction, posterior infarction, lateral infarction, septal infarction, circumferential infarction, and the combinations can also be occur like anterolateral, posterolateral, anterior septal. So these all are the types of infarction according to the anatomic region of left ventricles involved. Next, the type is according to degree of thickness of ventricle wall involved. So one is transmural, that is if full thickness is involved, then it is called as transmural. If subendocardial part is involved, then it is called as laminar infarction. Then next is according to age of infarcts. So according to age of infarcts, like newly formed, if it is newly formed, then we can say that is acute infarction is there, recent infarction is there, or fresh infarction is there. Then next is advanced infarcts. If the infarction is old, healed one, and organized one, then it is called as advanced infarction. Next, come to the epidemiology. We can see like in industrial countries, myocardial accounts for 10 to 25% of all deaths, and incidence is higher in elderly people. About it is about like 5% occurs at people under age 40, and males are having the more risk to have this infarction, and women during reproductive period have low risk. Means we can say like if we see the gender wise the incidence, so males are having the higher risk and women are having the low risks during their reproductive period. In we say that like in 2006, that studies revealed a prediction that India would account for 40 to 60% of cardiovascular diseases burden within next 10 to 15 years. So this is all epidemiology. Next comes to the etiology. So what are the causing factors due to which the myocardial infarction takes place? So there are some factors which can lead to myocardial infarction. That is, first one is your tobacco smoking. Then next is hypertension. Then drug abuse, obesity, stress, alcohol. Due to this, what happens? These all lead to the constriction of the arterial wall, due to which the pressure will rise, and also like there is an insufficient of blood flow to the heart, due to which the infarction can occur. Next, other reasons, other etiological factors are age also, gender, diabetes, hyperlipoproteinemia, then genetic also, like if a family history of ischemic heart disease is there, then there is a chances to have this infarction. Then hyperhomocysteemia, if there the quantity of cysteamia is more, then there is a chances to have the infarction. So chronic kidney disease also can lead to the infarction. Now comes to the pathophysiology. So we, by this flow chart, we can see the pathophysiology of myocardial infarction. We can see there are many reasons, etiological factors, like there can be erythrosclerosis, there can be arterial spasm, there can be with the erythrosclerosis, the plaque split is there, or the thrombus is there. Due to these all reasons, that myocardial infarction can be occur. So if there is a atherosclerosis, so you can see that then obstruction, gradual obstruction will occur. Definitely, if the obstruction will occur, it will lead to the ischemia. Ischemia, then it will lead to hypoxia, means there is a lack oxygen supply to that. If there is a lack oxygen supply, that is reduced oxygen demand, then it can lead to the angina. Then thrombosis can occur, and there can be a permanent thrombus occur there, and due to which the necrosis can occur. If the necrosis will be there, then it will lead to the myocardial infarction. The same way, if the arterial spasm is there, then there will be a sudden irreversible obstruction will be there, then it also can lead to ischemia, then it also can lead to the hypoxia, then it also can lead to reduce oxygen demand, then thrombolysis occur, then permanent thrombus will be there, and then necrosis occur, and finally myocardial infarction will occur. Then other reason, other etiological factor, like if there is a erythrosclerosis with this plaque split is there, then the occlusion can occur. Then again the same flow chart, like ischemia, hypoxia, reduced oxygen demand, then thrombolysis, permanent thrombus, necrosis, and finally the myocardial infarction will occur. So this is all about the pathophysiology of myocardial infarction. We can say that whenever there is the formation of plaque, or due to any reason, embolus, thrombus, any reason due to which what can be happen, like the obstruction can occur. If the obstruction can occur, then ischemia will occur. Ischemia will occur, then hypoxia will occur. Then finally thrombolysis, then permanent thrombus will occur, and finally it will lead to the necrosis, and which will be finally lead to the myocardial infarction. So this is all about the pathophysiology of myocardial infarction. Next comes to the clinical manifestations. So if what can be the clinical manifestation if the myocardial infarction will be there? So chest pain will be there, chest discomfort will be there, dyspnea will be there, fatigue will be there, and other symptoms like increased sweating, weakness, nausea, vomiting, lightheadedness, palpitations, anxiety, sleeplessness, hypertension. Because if there will be a narrowing of the artery, then definitely there will be the hypertension will be there. And we have already studied that one of the reason for increasing this all, that hypersystemia, the amount of like systemia will occur, then it will lead to the hypertension also, and hypotension, erythema will be there. So chest pain is less in women. Their common symptoms are weakness. Okay. So next we can see what can be the complications for this myocardial infarction. So complication include arrhythmia, cardiogenic shock, congestive heart failure, thromboembolism, rupture can also occur, and but there is a chance of 5% only. Then cardiac aneurysm, then pericarditis can be occur. So, like on which by seeing what things we can make out the diagnosis for myocardial infarction, or we can say how what are the diagnostic evaluation for myocardial infarction. So, by seeing the clinical features like pain, indigestion, apprehension, shock, low grade fever, we can make out that there can be a myocardial infarction. Then second is serum cardiac markers. We have to go through the investigation. We have to see the reports for the creatinine phosphokinase, lactic dehydrogenase, then cardiac specific troponins. Other we can see by the ECG, we will advise the patient to have one ECG. So by seeing the ECG report, we can make out that the patient is gone through the myocardial infarction. By seeing that what we the changes we can see in the ECG report, that the ST segment will be elevated, the T wave will be inversion, and there is a appearance of wide DQ waves. So by these all we can make out that there is a myocardial infarction occur. And other investigation we can sure it out that there the patient going through the myocardial infarction. So we can advise patient to have magnetic resonance imaging, that is short we can say MRI, then angiography, then positron emission tomography, and chest X-ray. So now comes to the management part. If we see the management part, so we have already told like management can be further divided into three, that non-pharmacological management, pharmacological management, and nursing management. So if we see this non-pharmacological management, so let's see first counseling and education of the whole. We by counseling the patient, by giving the health education to the patient, we can um, manage myocardial infarction. Some lifestyle measures can also uh, reduce the chances of myocardial infarction. Like if the patient is obese, we can advise patient to have to avoid junk foods, to do the exercise on daily basis. Like these all lifestyle changes we can. If the patient is a chain smoker, we can advise patient to avoid smoking. We can advise the patient to avoid alcohol. Okay. So next is smoking cessation. Totally smoking cessation should be there. Then avoid alcohol intake. Diet and nutrition should be proper. Then salt restriction, because the intake of salt can lead to the hypertension. So there should be salt restriction. We should advise the patient to have salt restriction. Next, pharmacological management. There are some medicines by which we can cure myocardial infarction. First one is thrombolytic agent, by which we can these all agents will drugs which will lead to the thrombolysis. Then anticoagulants, so that the blood clots will not form. Antiplatelets agents, antihypertensive agents, lipid-lowering drugs, vasodilators. So because we have seen that there will be a narrowing of the artery, so we definitely we need vasodilators so the arteries will dilate. Others like analgesics, anti-ulcer drugs, antidepressants. If the patient is having some symptoms of depression also, so we can advise the patient these drugs also. So, like treatment, this slide shows that treatment algorithm for MI. So, if any person going through this myocardial infarction, so what we need to do. So, first, if there is a myocardial infarction, pre-hospital on or arrival, then CTN spray, oxygen, pain relief, admission to the hospital, aspirin, thrombolytics, this all we have to take care. Then the patient should be admitted. Then start medicine like beta blocker, AC inhibitor, insulin. Then consider the revascularization, like some, if you want to have some procedures to be done like angioplasty, stenting, arterial bypass, these all should be done. If a long term there will be, then there should be, we have to start the rehabilitative classes like aspirin, beta blocker, AC inhibitors, statins. These should be given to the patient, advice to the patient to have it. So you can see that myocardial infarction, if the clinical risk assessment, how we have to do, if there is a high risk, so what we need to do, if there is a medium or low risk, what we need to do. If there is a high risk, then coronary angiogram should be done, then suitable anatomy with viable myocardium, then finally the revascularize to be done, and medical treatment we have to continue. Then if there is a low or medium risk is there, then assess LV function and ischemia and exercise tolerance. Same that we can go for to the coronary angiogram, and then after angiogram we can see that what is this high risk, medium risk, and low risk. If high risk, then definitely medical treatment should be there. Then medium risk, then it is important to have this medical treatment. Then low risk, then uh, like if we are having the medium risk, then after that we are not supposed to have the medical treatment. We can stop in that. Then low risk, then by the medical treatment it can be cured. So like these are the some surgical management. So we can do the percutaneous transluminal coronary angioplasty. That is, in short, we can say the PTCA. What we do in that we stunt is stunt is placed into the artery so that to remove or to inhibit the narrowing of the artery. Okay, so by this you can see that, okay, the artery is there, the plague, where the plague is there, we just put the stunt into that, and that stunt will expand, and balloon will inflate. After that, balloon will be deflate, and that stunt will remain in the part, and it will that in narrowing of the artery will remove. Okay. Next is erythrotomy, like by this we can remove the plaque, and the coronary artery bypass graft will be there. Okay, so by this also we can cure myocardial infarction. So this is all about the myocardial infarction. Thank you very much for listening me, and thank you very much. And so this is all we have learned about the myocardial infarction, and we can make it now like what can be the nursing management for myocardial infarction. If the patient is having myocardial infarction, definitely there is oxygen supply will be there, less oxygen supply will be there, so we have to administration oxygen to the patient. We have to take care of the patient at emergency level. So this is all about. Thank you very much for listening me.